with Riproad, a mobile marketing company, who, along their expertise, we created the service. And it's an online platform, so basically when a patient sends in a question, and I'm going to tell you a little bit more about the actual shape of the service, but I get an email which notifies me to then log on to the platform, which is very much like a Yahoo or a Gmail account. It's password protected. I go online, I answer the question. The calls are anonymous, so I don't see a cell phone number or a name, and you can follow the question threads. So I'm afraid this is a bit small, but this is what it looks like. And you can see that actually the very top question was sent several days before the last question, which is quite crucial sometimes. You want that, they don't know that you don't know them. So they'll send in a question that was related to a question they sent a few days ago and refer to it. So it's useful to see that. So after a lot of discussion with people who use text messaging within their healthcare setting in sort of different ways, I sort of shaped what I wanted from our service. And the thing that I was really adamant that I wanted was the ability for the teams to send in a question. So as I said before, to clarify stuff that they've heard in clinic, that when they've had that glazed expression that came over their faces, they'd just forgotten. And I was discouraged a bit from doing this, partly because of the workload. People thought it would be very labour intensive, lots of concern about confidentiality, about sort of crisis situations. But I wanted to give it a go, and I was given the opportunity to do a 6-month pilot, so there was no harm in giving it a go. If it didn't work, then it's not the end of the world, you just do something different. From the survey, it was clear that they wanted birth control reminders, and then I wanted to deliver health education to them. And they seemed keen about that in the survey as well. So we called it Health Bite, which is just a snippet of health education. So again, it was a pilot, and it was just intended as a 6-month pilot. And it was really just my clinic patients. So I was doing 5 to 6 clinic sessions a week, that's half days. And I would tell my patients about the service and give them a sort of palm card. And that was the only advertising, this little card. So nothing really up in the clinic, and just not the 10,000 patients that are coming through the door, but just the patients that I was seeing. And we had several varieties of these palm cards, and it has the sort of essential stuff you need to put on it, which Riproad supplied us with. And importantly for confidentiality was that we put here, remember to delete your text. So this is a typical question. They cover several aspects of, we'll go into the sort of the subjects of the questions. But the concern from the main hospital, because obviously this was quite a process before we actually set it up, of going through Mount Sinai, was the sort of crisis situation. So what do you do if at 2 o'clock in the morning someone sends a question in saying, what do I do? Just swallowing 50 Tylenol. Well, this is something that the patients are opting into. It's partly the responsibility is on them. We haven't recruited them, they are signing up for it. But we're very careful to tell them that we will answer the message within 24 hours. It's not instant. We will, if it's during the day, you're more likely to get a pretty instant answer. But if it's in the middle of the night, we guarantee we'll answer it within 24 hours. And the other thing that we did was we asked Riproad if we could go back and draw the cell phone number should we need it, if we were ever concerned about somebody sent in a question. And they enabled us to do that. And in fact, in a year now, I've done it once, and it was a total overreaction on my part and a sort of misinterpretation of the question. But this girl was delighted to talk to me, so it's fine. But we haven't had that sort of situation. So birth control reminders. Now, so these they can sign up for either daily or weekly birth control reminders. We have a little FYI to explain what BC, birth control, is. You'd be surprised how many sign up for it and don't actually know what it is. And they go out for the pill, they go out every might be able to do in the future. And then the health bite. So as I said, this is like a snippet of health education. And they get this every week on a Thursday afternoon at 4 o'clock. And here you can see it says a maximum of 10 messages per month. And we put that in there to just give us a little bit of leeway should we want to send some polling questions or a survey. So we've got the ability to do that with those extra messages. And we've tried to include a real range of subjects, so from bullying to obesity, immunisations, general health care, just a broad range of topics. This is a typical one. Okay. So at 6 months, we did a bit of an evaluation. And evaluation is, again, very tricky because they opted in voluntarily. It's not a study, so it's just trying to work out how to evaluate it effectively, and it's something again that I really want to look into. But we just basically did a tally of figures at 6 months, 35 on birth control reminders daily, 14 on weekly, and put 291 unique users. So 291 users had done 1, 2, or 3 of the functions. And you can see that, overwhelmingly it's the chat function which appears to be the most popular, with 493 at 6 months, and now around 970. And so also at 6 months we analysed the content of the questions. So we did this by coding the questions, and they fitted into actually 10 different domains, which really reflects the work that we do at the clinic. And then someone else did the same coding for sort of inter-user reliability, and then we came up with these figures. And so you can see quite outstandingly that birth control is the subject that they send in the most questions about. And then STDs. And the questions about STDs are incredibly straightforward. So, does the antibiotic I took work? Does my partner need treatment?